Dating apps. Some people say it's driving a big trend in cosmetic surgery. We're going to break it down full throttle next. Hey, Doc audience. We're going to talk about this trend, the trend in cosmetic surgery that's driven by supposedly, allegedly dating apps. All right, what do you think?
Well, I mean, I've had my patients tell me that, but as you know, the dating apps, at least the static photos, then sometimes don't ever resemble when they meet them. That's what my patients tell me, and they go to the Starbucks and they see that person, they go, oh, I'm not going to that person. So I guess if they're live videos, maybe, but sure, I think obviously the first impression is always a good one, and that's usually the physical appearance. So I don't know if it's driving him to have plastic surgery. It's probably driving him to find a mate, And so I think it's a starting point, and I just obviously listen to what my patients tell me. Yeah. There's the good and the bad.
Jerry, are you seeing that in your practice? Seeing any women or men coming in because of their dating app profile picture?
I don't know if it's a chicken or the egg concept, but I mean, essentially, I think we're in an era now where it's like we're all on TikTok, we're on Instagram, we're seeing ourselves all the time, we're on Zoom meetings since COVID, and so I think we already are headed that direction, and I could see, maybe it spreads over into the dating worlds. I'm far from that world right now, but I mean, that's where the term catfish came from, right? When you get catfish and someone shows up and doesn't look anything like you thought,
imagine that,
or 20 years older, or whatever.
Yeah, that's hilarious. That's a really good point, because we talked about that during COVID, this trend because of Zoom. People look on Facebook going, damn, I need something done. I look like shit, And but yeah, I mean, I think there's something to this. I don't know if people come into my practice and they say, well, first of all, unless they're like on a weird dating app, like I'm mainly a breast and body practice. But I think people do see themselves, and I need to, if I'm on a dating app, I want to look good. Right. People see me and they, say, hey, that person looks pretty good. I'll ping them back. So, Jason, you've got a good profile on a dating app. What's your experience?
We used to see a lot of this stuff during COVID because everyone was on Zoom and their necks looked terrible, their eyes looked terrible. That was that. But nowadays, I live in Boca. My facial patients are older, so I'm not really seeing many of them on the dating app. But if you want to look at TV, you got to look at the shows like Love Is Blind, where no one even looks at each other. I mean, they're behind a wall and just talking to each other. So I think that's the best kind of dating app there is.
Yeah, didn't you were telling us a story about one of your office people or something? What was that? You were saying just earlier about somebody was doing something?
Well, office staff is all they're watching is Love Is Blind, whereas basically, two people are in two different rooms, like a male and female or whatever, and they get to know each other over a course of time, and then some of them even get engaged without even seeing the person. So that's like the exact opposite of this. Kind of cool.
How did that work out?
I don't know. It's like I'm looking at it, but you guys are crazy. But
I used to do. It's funny when I was back in med school. There's a friend of mine, and so he asked this girl out that worked in the operating room, but he never seen her face. She always had a mask on. And the funny thing is they ended up getting married, but he asked this girl out. He goes, well, I liked her eyes, and that's what he said. But I always thought that was really good. Have you ever seen what she looks like? He goes, no, she has a mask on. I was like, okay, I hope this works out. Well, I guess it worked out pretty well because they're still married,
I guess so.
Yeah. Charles, so what are you seeing in your practice with this? Are you having people come in that need to up their game on their profile pic on their dating app?
I think with profile pics and dating apps, you have a lot easier tools such as Photoshop or filters to improve your appearance. I'm not sure I'd fully attribute it to that, but I do think what you said as far as COVID, people became a lot more aware of their appearance and seeing themselves in camera, and with the selfie culture we have, I think people have kind of become more accepting and more proactive about trying to improve their appearance through plastic surgery.
Yeah. Speaking of appearances, I always wanted to ask you this, but when you were playing hockey, did you have really long hair? Did you have good flow like I do?
No, I never had the long hair, unfortunately. I don't think I could pull it off.
Yeah, because it's kind of totally different, but there's that image in hockey that you have to have long hair, and they haven't had like the Minnesota hockey hair videos, which are hilarious, where these guys have the craziest hair you've ever seen, and it's actually going on right now. But
Maybe they'll try growing it out.
yeah, it's pretty full throttle actually. So you think this is there's probably some truth to
Yeah,
what this story's about?
I think there is. I mean, certainly if people are honest on dating apps, showing you a real photo, I think, people obviously, the first impression is always, they have to have at least some semblance of attractiveness that will say, hey, I'm going to, press left or right or whatever the dating app says. So I think that's true. But as I mentioned earlier, the big thing is so many people put more photos on, and so I don't know. But I think people are at least making the effort saying, hey, I want to look better, feel better, and, that's, 2 likes.
But
Yeah.
it brings up a bigger picture a little bit of, it goes back to that plastic surgeons and our co-specialists, we offer lots of things for people who want to improve their appearance. So I think it's out there now that when people have issues, they come see us. They don't just kind of hide at home. They do come to us and ask our opinions and, get your eyes done, get your face done. So it's good for our businesses and it's really good for the public.
Yeah, I totally agree, Jason. I think that's it's kind of just like same song, different verse, of things we've seen in the past. I mean, people come to us because they want to look better,
Right.
Whether it's just what they look in the mirror, they see themselves on Zoom, or it's on their dating app, or who knows. Their wife tells them, "You look like crap. You need to go see Dr. Rohrich or Dr. Chidester." I think that's just what we do.
Yeah.
And well, let us know what you think. If you're on dating apps, have you seen a plastic surgeon? Do you think this is legitimate? Make sure to give us a like and also subscribe. And we'll see you next time on Hey Doc.